As many people are beginning their holiday celebrations, I felt it important to update what we know right now about what is happening with Omicron and how it is spreading in British Columbia, and to provide some guidance on what to do if you are developing symptoms or have developed symptoms of COVID-19, and of course to talk about when one needs to get tested. What we are seeing across this country and across the globe is that Omicron is different. It is spreading in a way that is very different from previous variants. In a sense, we're in a different game, a different pandemic now. Some parts of it we know more about. We're putting that puzzle together globally. We know more about the infectiousness of Omicron right now, and it is more highly infectious than any of the other strains of this virus that we've seen. We know more about breakthrough infections and about reinfections. And there's data that's showing up from around the world that tells us that we can get more breakthrough infections in people who have been fully vaccinated, but they tend to be less severe. Those are things that we're still watching. We also know that people who have had previous infections are much more likely to get reinfected with Omicron. So those are important things to remember. We still do not have a full picture about how severe Omicron can be across the board. And that is something that we need to continue to monitor and watch. And that's why we're talking today about the things that we need to do until we understand that in the coming weeks. Earlier this week, I mentioned that all of us would likely be exposed to this virus, to Omicron, knowing the way it was spreading in our communities. But this does not mean that all of us will get sick or will get severely sick. It's an entirely new game, as I said. What we are seeing is that Omicron is more likely to attach to the upper airways, to those ACE2 receptors in our upper airways, which means it can spread with very small amounts of the virus. It replicates quickly, and it means that those smaller particles or aerosols are much more important, and it can spread more easily, especially during activities like singing or talking closely to each other indoors where ventilation is poor or breathing hard. So people are getting infected with a much smaller amount of the virus and more quickly, and they're passing it on to others. And with this Omicron variant, what we're seeing is these pieces of the puzzle are coming together, is that the incubation period, or the time between exposure and getting sick yourself and being able to pass it on to the others, to someone else, is very small. What we were usually seeing in 5 to 7 days on average is now down to around 2 to 3 days. So you can pass it on to others even before you realize that you're positive for the virus. We also know that Omicron is spreading faster in people who are not yet vaccinated. We know that because we see that transmission being explosive in some of those settings, and it's because our immune system has not developed those defenses that are very specific for this virus, for the spike protein that vaccination gives. This means that if you are at all sick right now, even if you think it isn't COVID, even if you think it's just a mild cold or a flu, you need to take precautions and stay away from others, particularly people who may be at risk because their immune systems aren't working so well, because they have not been vaccinated, or because they're older or younger. Even now, especially if anyone in your family is at risk, you need to stay away, even if you don't think it is. It's COVID. The speed of transmission at this point also means that our case and contact tracing cannot keep up. We can keep up with people who have a test, and we'll talk a bit more about testing, but we cannot find contacts, and people know this, within 2 to 3 days. It often takes a little bit longer. So it's really important right now that all of us pay attention to this. This virus is spreading. It's spreading in all of us. And we need to take those actions, and we can take those actions, which keep ourselves, which make a difference to control the impact the virus is going to have both on ourselves and on those we are closest to, that we are more likely to spread it to. This means we need your help to make sure that you are taking the actions you need to do and notifying people around you if you are positive for COVID-19. In addition, our testing centers are at their maximum capacity. We did over 20,000 PCR tests yesterday, and that's the maximum that we can do. So I want to be very clear. Do not go to a testing center unless you have symptoms. And then we need to preserve the more accurate PCR testing for those who really need it. The testing centers are not for pre-travel screening, nor do they give you a green light to spend time with others. We've talked about this before, but this is more important than ever. A negative test is not a green light. All of our testing is for people who have symptoms or for people who need to rule out, and for people who need to rule out that it is COVID. So this is important right now more than anything. The testing centers are to confirm that someone with symptoms of the virus has COVID-19 or to rule it out for those key workers like healthcare workers or emergency responders who need to be able to go into work. I encourage everybody to go to the BC CDC Symptom Checker online. It's a good tool to use to help you understand if you need to get a test. Right now, our PCR tests need to be used for those who are at highest risk. So that means people who are older, over age 65, people who have underlying illnesses, and people with more severe symptoms where this makes a difference in how they get treated and access to treatment. So that is the first priority at our treatment centers, and as well to test people with symptoms who are hospital workers, emergency responders, and others who need this. Rapid testing is also now being used to supplement our PCR testing at many of our testing centers. It's also being used in a number of different settings like remote communities to really determine if COVID has made it to those communities. Rapid testing will be used again for people with symptoms to help you understand what you need to do. It will be mostly targeted to people who are younger with milder symptoms without risk factors for more severe disease. Given the rate of transmission that we are seeing, if you have any symptoms of COVID-19, Omicron is different now. If you have any symptoms, you must assume you have COVID and take measures to avoid passing it on. If you are younger and vaccinated and no other risk factors, you don't necessarily need a test. You just need to take these actions now. If you are fully vaccinated and have mild symptoms, you should assume you are positive, stay home and stay away from others for 7 days. If you are not fully vaccinated and don't have other underlying risk factors, you must isolate for 10 days. And this is because we know that vaccination helps us manage these infections more rapidly, so we shed less virus for a shorter period of time. You should as well notify your close contacts, and that's people that you've spent time with, particularly indoors in close proximity without wearing masks, and they need to monitor for 14 days to check for symptoms themselves. Anybody who is unvaccinated, who you've had close contact with, if you have symptoms and positive for COVID, needs to stay away from others and monitor and self-isolate for 10 days. This means, regrettably, that we will need to adjust our holiday plans if we have symptoms right now that could be related to Omicron. You need to isolate yourself from those people in your household, particularly anybody who's at risk and anyone coming to your home. We all need to gather together now and continue to support each other, to support people who have symptoms, who are doing their part to keep us all safe. Things like bring your turkey dinner delivered to you instead. Your close contacts and anyone you live with should limit their interactions with others and closely monitor themselves for symptoms as well. Anyone with someone in their social network who recently tested positive or who is awaiting test results or is at home with symptoms, you should consider yourself a contact of Omicron. Don't go to group gatherings, and particularly don't go to gatherings where you'll be with people who have risk factors for severe illness. If you do have symptoms and they worsen, or you're having difficulty breathing, chest pain, can't drink anything, and your self-care is not helping you manage your illness, then do not be afraid to call 911 if you need it, to call 811 to get advice, or talk to your healthcare provider. While I caution about the need to get tested, if you are seriously unwell, please do not hesitate to seek care immediately. One by one, this piece of the puzzle that we didn't know yet, and the one piece of the puzzle that we are still working on, is how severe illness Omicron will cause. We're watching very carefully hospitalizations and ICU cases in this province and around the world, and we've had some positive results on that side, some positive tests coming in, positive studies coming in the last few days. Particularly, some hope that we see from what's come out of Scotland, from the UK, and from South Africa, which seems to indicate that in many cases this is a milder illness in most people. So that is hopeful news. We don't yet know that for our context here in BC, but I also am very hopeful. We have a lot of people who have stepped up and gotten the protection that vaccination offers, that have gotten their booster doses, and we have been good at taking these measures to protect each other. We will continue to be watching these measures, the data that's coming from around the world very closely. There's still some caveats that we don't yet know. Particularly, we think about the study in Scotland which showed a much reduced risk of hospitalization. That was still in people who are younger. And we know that younger people have a lower risk of hospitalization anyway. As we're starting, as this Omicron is progressing and moving into older populations, we need to know if that still holds. So there's still a period of time of uncertainty right now. So this is a different virus, this Omicron, that is now causing what we are seeing across our province. And once again, a different holiday season for all of us. For many, including me, physical activity, going to a gym or a fitness center, is a key part of mental and physical well-being. And I know that this has impacted people, that we've required these to be closed on a temporary basis right now. This is a very high-risk period. We see this is transmitting rapidly, and particularly in young people, and when we're doing those types of activities where aerosols can be generated. I know that all those in the gym community have been doing their part, and gyms and fitness centers have had really good protocols in place, and people have stepped up and gotten vaccinated to protect each other. And this part, I now need you to continue to have that contact and connect with those people in your community. Do things online. Go outside and meet for a walk or a run if you can. Connect and support each other virtually right now to slow down the spread, but keep that ever important connection that you get through your community, whether it's your church community, your gym community, or the people that you're closest to. I would like to assure you as well that the uncertainty around this virus remains high, but we will be back to doing those activities in gyms, in fitness centers, in all of those other places, as soon as we know more. And while we need to keep our groups small right now, limit our in-person connections, let's ensure we are maintaining those important social connections in a safe way, like we did last year, like we have learned to do. It is so important to connect with each other, especially this time of year. And I encourage you to resurrect all those things that we were doing before. Now's the time to bring them back out again, whether that's reaching out to people who may be alone, sending them a text or a note, or calling somebody, deliver a meal or baking to someone who may be isolating. Continuing to connect virtually is so important. We know it's not the same, but it will get us through this next few weeks. We need to give each other a booster shot of communal kindness right now. It is incredibly important, and safe connection. And I ask you, let's continue to do this together. We will get through this wave, this new challenge that we are faced with, and we'll get it through together by being kind, being calm, and being safe. Thank you.